Hi, my name is Kathleen Lisson. I'm a certified lymphedema therapist and a board certified massage therapist. And this is kind of my recap of a day in the life of someone that does plastic surgery recovery massage. So my training is I'm a certified lymphedema therapist. I got into it after massage school. I started with oncology massage class and then learned about lymphedema therapy because lymphedema is a side effect of cancer treatment. It's also genetic, but it can be a side effect of cancer treatment. And once I became a certified lymphedema therapist, I was actually asked if I did post-plastic surgery clients, and I saw how a lot of times the plastic surgery swelling will reduce exactly the same way as a lymphedema swelling. So my education immediately goes right over, all the skills you need to in this modality to treat post-plastic surgery as far as the massage part. And then I kind of asked around and took continuing education classes, went to lymphedema conference to learn the different skills that my fellow certified lymphedema therapists were using to reduce fibrosis in their clients with lymphedema. And that 100% comes right across to when we see fibrosis after plastic surgery. So those are the main two things that I treat. I help reduce swelling. I reduce the lumps and bumps after plastic surgery, reduce the fibrosis. I only really see true cases of fibrosis that really need a lot of hard work in about 10% of my clients. Most clients just have something we call like putty swelling, woody swelling, and that is just swelling. So it reduces very nicely with manual lymphatic drainage and some of the other modalities that I practice. But anyways, I'll go over today kind of the day in the life. So this was a little bit of a busy day. I usually don't take 5 clients, but it worked out really well because I'm here in my studio and all of them could come to me. So I had plenty of time in my schedules. Though I had a full day, I had time for lunch, I had time for dinner, and I give myself a half-hour break at least in between each client. So I can change the sheets, I can wait for the client to put their compression garment on, and I don't feel, they don't feel rushed, I don't feel rushed. I can change the sheets, I can do their soap notes while it's still at the forefront of my memory and write myself any tips or ideas for what I want to do next time. So let's kind of go over it. My first client was really interesting. I love this day because I can share so many different things, so many kind of like inside tips. So the first client I talked to earlier in the week, it's Wednesday now, and I think I talked to her Monday, and she called me and she had her Brazilian butt lift and liposuction in Miami. So what they do definitely in Tijuana, in select other states, is the therapist will cut open the client in the cannula incision and push the fluid out. So I don't do that in California. It's not the massage board, NICTIMI, it's not allowed. California laws, as I read them, the statutes, it's not allowed. So I just don't do it. I think it opens the client up for further infections when you're opening someone up in a non-sterile environment. So I kind of stay away from that. I want my office to be clean. So I've seen this before. I've seen client asks before. So I kind of know when they get a phone call and they're really close after surgery and they have a lot of swelling and they want to know if I do lymphatic drainage. I have to be very specific that lymphatic drainage does not mean incisional massage, which is where you cut the patient and you push fluid out. Manual lymphatic drainage works with the lymphatic system and the swelling goes out through urination. So what she did was say like, well, does it even work? Which I'm totally fine with, it's a valid question, but I explained to her my training and how I had helped other people, and if she wanted to, I gave her other resources that she could go to. You can definitely go down to Tijuana if you want the incisional massage, and she called me back the next day which was yesterday. And she said, I want to get in to see you as soon as possible. I talked to not one, but 2 plastic surgeons in town yesterday, trying to get an idea of what's going on with my body after the surgery, and your name came up twice. I really need you. So I was like, great. We need to know that it's not going to work as fast as pushing the fluid out of the incisions, but it will work. So she came in this morning. She was my very first appointment. I opened the office a little bit earlier so she could come in as soon as possible. And we had a great educational session. I talked, I told her what I saw on her body and what I thought we could do in the future to help her out. And at the end of it, she came out and she was like, you know what? I need to go to the bathroom, which is really weird, she said, because I haven't been drinking water at all. Like, why do I have to go to the bathroom so bad? And I was like, that's the lymphatic drainage. It's working. So I actually have, from when I learned oncology massage, one of my tips from my teacher was you keep a lot of extra things in the room when you help people in an oncology massage setting. And one of those things is the biggest, giantest bathrobe that you can. So I had the bathrobe right here in my office, and I gave her the bathrobe, and I was like, just run down to the bathroom and pee, and then you can come back and put your compression on, correctly at your leisure, because you won't feel so, overwhelmed with the need to urinate. So that was good. Very happy. She booked 2 more times. It's great to be able to take someone that maybe only knows about incisional massage, maybe they think that's the only thing that can help them, and to show them that there's a way we can use the body's lymphatic system to help them. So that was just client number 1. I have 4 more to go. My second one was male liposuction, and he had gynecomastia surgery, and he was actually referred to me from one of his family members had been to see me for post liposuction massage as well. So he came in, he'd already heard from his family member that I was, doing a good job. So we've just helped him with that and given him some ideas on how, when he goes back to exercising, how that would help him, how having a tighter shirt would help him, kind of just getting him on his way. And then I had my middle client was really awesome. I have a wonderful doctor who refers clients to me. He does, after mastectomy, he does the reconstructive surgery, and he takes liposuction to get fat from the abdomen, and then he transfers the fat into the breast area to give them a new breast, a reconstructed breast. But what he has seen is the clients are taken care of in the insurance system for the breast part of the operation, but there's not much that they can offer for the liposuction swelling part. So he sends clients who want to come to me and can afford it. He sends them to me, and I take care of them. So it's we have a relationship where I see a few of his clients that he refers to me a month. So I got to see one today, and she was very happy, and it just felt like she was on her way and she was going to heal. So that's what I hear from a lot of clients. Like, they need to see kind of the light at the end of the tunnel. They need to grab onto something so they know that they're in the process of getting better, and then their whole being, opens up and they feel a lot more positive about their recovery. So I'm super happy to be able to draw upon everything I learned about oncology massage, everything I learned in my lymphedema therapy to help clients after they have their reconstruction after breast cancer surgery and mastectomy. And then I had my 4th client was a she had liposuction all around her abdomen and also in her arms. So we got to, this was the 2nd or 3rd appointment with her, and then I'd gotten just what I usually do for the first 1 or 2 appointments is they don't have a good range of motion, so I use massage to take the swelling down, kind of get any lumps in advance to make them smaller so it doesn't turn into like a big lumpy mess. Usually if you see me regularly, you don't get into any problems with having a lot of really bad scar tissue or lumps, because we're taking care of it regularly. You're wearing the right compression garment, you're doing the massages correctly, and then I usually have clients that have a good result if they came into me and they were looking pretty good when they came in. So she was looking pretty good. She was very fresh when she came in. So she's going to be a great case because I got to her, sooner. I can get to people after a month, after 2 months, we can make some improvement, but geez, it's really nice to see someone after like 5 days or a week. So she had the Lipo 360 in the arms. We did some with the IASTM and the hot stones to kind of get that scar tissue out of the arm, to make the arms look a little bit better after liposuction, and then the regular thing that I do with the MLD and just a little massage on the abdomen. So she felt really good. And then my last client is one of my clients that I see just about once a week. So she had some liposuction. She had a lot of liposuction in the abdomen, and she's one of my favorite because she's a nurse, and I love my fellow medical professionals because they understand the lymphatic system. They know what we're doing. They're actually really honest with me when they're non-compliant, so we kind of we can figure out together a way to get them to fit this surgery recovery into their busy schedules. And the other reason I really like the medical professionals, because they have like a 9-hour shift, a 10-hour shift, a 12-hour shift. So when they're lying on the table after their shift has ended for the day, this is their time to relax, and most of them end up going to sleep for at least a few minutes of the appointment, and I'm doing some really deep work to break up the scar tissue and make everything flow again, and they're sleeping while I'm doing it. So even though I'm doing really deep work, I've developed a technique. I've seen how it works to have a modality that's really, really gentle. So gentle that if someone's tired, they're falling asleep on the table while I'm doing my cupping, while I'm doing my IASTM, while I'm doing the massage, to make them smoother, and there's no pain. It's not painful at all because in fact they're asleep. So that was my long and busy day, and I am just so, I have to take a deep breath because it was a busy day, but I'm so grateful. I'm so happy that I'm in this career, that I'm able to use the talents that I had in massage school. It was a lot of money, a big chunk of change. Lymphedema therapy as a massage therapist was a little bit of a big chunk of change. So I'm really glad that that I found the way in my community to take these skills and make them profitable, so that this is my full-time career. This is what I do. This is what I'm known for. I'm able to share my expertise with clients, get them good results, and put food on my table at the end of the week. So that is the day in the life of the plastic surgery recovery massage therapist. Have a good day.